Well, hello everyone. This is Keith Salvione coming to you again from Salvione Associates. We are excited about talking about this topic today because we feel it is an important topic for you to be very aware of when engaging with three entities that we're going to be talking about specifically. Three entities, okay? And so I'm showing my webpage here. As you can see, I use a lot of my resources here so you can just find them. So salvioneassociates.com. And of course, you see everything listed here. Okay. And we are going to jump over to helpful resources. Helpful resources. Okay. And we are going to scroll down to this section here, right? And who can I trust with my healthcare? Who can I trust with my healthcare? Just click on that link and this will drive you right down into this section. Now, I'm not going to read the entire thing, right? I know you can read, so you don't need me to do that, right? But there are some things that I wanted to specifically talk to you about. And this right here, the role of financial incentives. The reason that fraud, waste, and abuse is in the billions of dollars, billions of dollars. I can't even stress that enough. As a matter of fact, I have financial information that I acquired, um, and I'm thinking about putting it somewhere here on the website. But I can tell you, rest assured, right? As a matter of fact, why don't I just take a few seconds here and I will read to you what I did find with regards to fraud, waste, and abuse. And I can just read it to you for now, okay, if that's okay. And then at least this will give you some good facts. So I have here a recent 25 and 26 report shows that fraud, waste, and abuse continue to drain billions from the healthcare system. The latest reported figures in 2025, 2026 from Medicare improper payments. Ready for this? Medicare improper payments reached $56.73 billion, right, in 2025. This includes 28.83 billion for what they call fee for service, okay? Fee for service plans. Those are health plans, okay? We have $23.67 billion for Medicare Part C, Medicare Part C, 4.23 billion from Medicare Part D. Medicaid, you might want to sit down for this one. The national improper payment rate for 2025 hit 6.12, totaling roughly $37.39 billion. Billion. The ACA, the Affordable Care Act marketplace plans in 2025, okay? This hit $27 billion in fraud, okay? Unbelievable amount of money, okay? In 2025, law enforcement takedowns through fraud, waste, and abuse, they uncovered around 324 defendants for schemes totaling $14.6 billion in intended losses, the largest in U.S. history. Okay. Now, there's a few other things I could say, but to be honest with you, I really want to equip you. I want to equip you from being taken advantage of because you see, everyone is paying premiums for their health care. And if you're not, you're paying co-payments, co-insurance, and sometimes, even with Medicare plans, deductibles. Okay. So this is just me. I need to protect my clients from any kind of manipulation from these particular entities. Because you see, here's the deal. Right here, where it says the role of financial incentives, okay? Look at the first part, insurance companies. That's entity number one. They are incentivized to limit costs by denying, delaying, or restricting care. I could tell you story after story from insurance companies denying claims being paid out, okay? And they may tote on their website, or they may say in meetings, we paid over such and such amount in claims. Okay. But what they won't tell you is the amount of premiums that they have collected. And then are they willing to juxtapose those two things? How much money did you collect? How many of you people on a C level, corporate level, C level, like CEO or anybody with a C, right, in their title, okay, are getting millions of dollars in salary, millions of dollars in salary, okay? So they're collecting a lot of money, but how much are they really paying in claims? You know? Okay. So they're incentivized and they're going to deny because the government does restrict these insurance companies on how much they can actually make as a profit, believe it or not. So they are keeping every penny they can keep because of these restrictions on them. So I'm going to teach you a little something about that. All right. When dealing with insurance companies and insurance agents. Okay. Hospitals and health systems. Okay. First of all, never ever go into a hospital by yourself. Okay. You need to have someone there as an advocate for you. That's what you need. You cannot walk in there because if you walk in and let's just say you're not feeling well, all right, or you're having a hard time being clear because of the sickness or illness that you're having at that moment, you're going to be taken advantage of. I'm just telling you right now. Hospitals are there for the sole purpose of making money. Now, yes, they do care for their patients. Of course they do. Okay. But I'm telling you their primary motive. Okay. It often relies on high margin procedures and tests and admissions to remain financially viable. They are going to run as many tests as possible and as many procedures as possible, especially high ticket items, CT scans as an inpatient. Okay. I mean, the old saying is, have you ever heard of a pillow that costs $300 in the hospital? Guess what? That's actually true. Okay. So we need to be aware that when we walk into a hospital, we basically are a widget. Okay. We are a widget. And unfortunately, there is potential because of the financial incentives that we're going to be taken advantage of because we're nothing but an opportunity for them to make money. That's what this is all about. I'm not saying they don't care about your care. I'm saying they care more about your wallet. That's what I care about. Okay. I'm sorry. That's what I mean. Physicians, basically the same thing. They're rewarded by volume. That's why sometimes you'll hear people complain about sitting in the waiting room for 30 minutes to 45 minutes. Okay. Because unfortunately, physicians are taking on way too many patients. They should have closed their panel. It's called a panel, and they should have closed it, and they didn't. And they keep it open because, after all, it's money. It's money for them. Okay. Specific procedures rather than outcomes for patient or centered care. So I'm going to go through these a little bit more. All right. But I wanted to point you to this helpful resource in this particular area so that you can take the time to read it. And then I'm going to point to some forms that I would like you to download to your computer and maybe keep with you in the event that you go to a hospital, a primary doctor, or a physician. Okay. Specialist, sorry, a specialist. So again, right, fraud, waste, and abuse is a big thing. Examples are, right, here's some examples right here. Billing for services that are not provided. How about upcoding? Let me tell you a story. If you walk in to a doctor's office and you're there for your annual checkup, okay, and you're there for preventive services because those are usually free. There's no charge. The insurance company is going to pay the visit and anything else that pertains to preventive services. Okay, it's a once a year thing. They want to make sure you stay healthy. And so there you go. However, if the doctor says to you, and this is where you've got to be careful, whether it be a PCP or a specialist, they're going to say to you in a very casual conversation, so is there anything else I can help you with? Now, that was a generic sentence. You should immediately reply by, well, what do you mean? What do you specifically mean? Because they have been trained sorry about that. They've been trained to ask questions because if they can get you to complain about anything at all, okay, just shutting down my phone here. If they can get you to complain about any kind of ailment that you're having, and don't get me wrong, folks, if you have an ailment that you need to talk to your doctor about, all means the door should be open. What I'm saying is just because you woke up and you're a little stiff, you know what I mean? Don't mention it. Why? Because you just moved from preventive services to diagnostic. Now the doctor is going to say, I have a reason here, Mr. Insurance Company, to bill you because my patient complained about this and I had to order a test to make sure that he was going to be okay. All I'm saying is, okay, is be careful and having conversations so that you can, and you know, unless you feel really comfortable with your doctor and you say, and you don't have no problem by saying, which you shouldn't say, I'm not going to be charged for this, am I? I'm not going to want to have to pay for this. I'm here for preventive services only. I'm here to, you know, I'm here to get my blood work done, you know, urine specimen maybe, whatever the case may be. You know, check me out, doc. Okay. This isn't an opportunity to make money. I'm trying to stay healthy for another year so I don't have to spend money or spend loads of money on medications that are polluting my body. Okay. All right. So understand that there are some procedures here that you got to be looking out for. And if it's outside of preventive, if you're there for a specific reason, no problem. Of course, you got to stay healthy for whatever the issue is. I understand that. Okay. I'm just saying that remember, doctors are financially incentivized and they are going to find any way they can to bill the insurance company whatever they can to make the money they need. Okay. All right. So, are there conflicts of interest? Patients often assume medical advice is a neutral or objective, right? Well, they're not being objective. They're not. Insurance company policies are designed to reduce payouts, hospital pressure to increase revenue, pharmaceutical companies, absolutely, okay? And corporate ownership of medical practices prioritize profit over individual care. Listen, why am I saying all this? You say, gee, Keith, you sound really paranoid about this. You got a problem with doctors or hospitals? No, I have a problem with fraud, waste, and abuse. Remember the $1 billion thing that I just got done reading? Okay. Somebody's committing fraud, waste, and abuse. Who is it? It's hospitals, specialists, and primary care, PCP doctors. That's who's committing fraud. Okay. And sometimes they even work with the patient and slip them $100 to give them their information. I'm just telling you, folks, it's a fact that fraud, waste, and abuse exists, and it's in the billions. And the reason we have such healthcare problems in this world and how come it's so costly is because of that very reason. Okay. Because of the fraud. All right. So that's my problem that I'm having. I love a good doctor. I love a good doctor, and I love a good nurse, and I love a good hospital. But I'll be honest with you, they're becoming few and far between. All right. They're money driving machines. Okay. So you have got to protect yourself and your wallet. Okay. All right. So there's other things here. Here's some impacts for you personally on the patient side. Delayed diagnosis or treatment, pressure into unnecessary procedures. Okay. Don't be afraid to talk back to the doctor. There's a million other doctors out there if this doctor doesn't want to see you anymore. I had a doctor one time and I didn't feel comfortable getting certain procedures done prematurely. And because he wanted to do it and I didn't do it, he told me I can't come back to his office anymore. I don't care. Fine, I'll go find somebody else. There's two of them down the street. I mean, it doesn't, there's so many doctors in Florida, okay, that you don't have to be pressured into doing anything that you don't feel comfortable doing, okay? Especially since their main goal is to make money, okay? Inadequate care, due to coverage limitations, confusion, stress, financial hardship. This is where my heart is. My heart is trying to protect the wallets, okay, and people being taken advantage of. I got very high protective instincts over people. I don't like when I see somebody taken advantage of just because they didn't know something. Okay. So I'm going to fight. I'm going to fight for you. Um, and of course, erosion in the healthcare system itself. Okay. So I encourage you to want to take a look at this, read through this, just look at it quickly. You know, you don't have to read every little thing, but there are some great tools in here, all right, that you can use. And then at the bottom, I did for fraud, waste, and abuse, you can report it. I would often report it. You start with the insurance company, okay? They have a department called grievance and appeals. All right. And you would put in a grievance with them. All right. And they have time limits that they have to work with in order to answer you. And then you have time limits also to get back to them and so on. Listen, you need somebody to help you guide that process of doing this. I've done this a couple times for people. Uh, Now, this week, literally, when I say a couple times, I mean this week I did this for people. We took care of a dental claim for a nice person that we help with their health plan, and then a family of four that I'm helping out with some particular problems that they're having with an insurance company. Okay. So I've got plenty of experience in this and I know the ins and outs. If you need help, no obligation, no cost, just call me and I'll be happy to help you. And the FBI, there's a link there too to turn in insurance companies and doctors and hospitals committing that kind of thing to the FBI. Now, I want to show you one other spot on the web on this website. Once you get done reading this, and you'll see it's good information, but you know it can get a little dry. The bottom line is fraud, waste, and abuse. How to protect yourself is what I'm most interested in from these three entities. So let me recap real quick before I jump to the next section. One, you walk into a hospital, never walk in alone, never. Okay, do your best to have someone else there. All right, and then when you do get into the hospital, beware, beware of any kind of additional procedures that they're trying to say that you're going to need right out of the gate. Okay, let me give you an example. I went to the hospital one time and I was in a lot of pain, a lot of pain. I had some kind of nerve thing going on and it was killing me. Well, I wasn't too coherent. I was in so much pain. And they brought in an occupational therapist, a physical therapist. They were bringing all these people in here while I was in pain, saying, hey, we're going to come and see you later. Basically, what they were doing is getting permission for them to come. Really, what they were doing is getting permission to bill the insurance company that those people showed up in my room. Didn't spend any time with me. I had one guy there for 2 minutes. Didn't see anybody else, but they billed the insurance company. And guess what? I had to pay also out of my pocket, okay? Thousands of dollars. I'm just telling you, folks, I want to protect you from these kinds of things happening. So that's number one. You go into a hospital, have someone there, be your advocate, and don't have any other tests. You just tell them, I am not agreeing to anything other than addressing my immediate concern, right? Or my immediate issue that I'm having right now. Don't try to push additional services on me or anything else. Don't sign anything without understanding it. You just tell them, I'll sign everything later. I'm not signing anything right now. I'm in pain. That's what you say. Okay. That's why you got to have somebody there protecting you. Okay. All right. Doctors, when you walk into a PCP or a specialist office, okay, like I said earlier, if you're going to speak to them, then just literally, if you're there for preventive services, be very clear about why you're there. If you're there for a particular problem, be very clear about what that is. If they start asking probing questions about the problem and they try to tie it to something else, what they're doing is, okay, and you need to be clear on this, is why you got to ask questions. You got to literally say, does that have anything to do with my knee? Why are you pointing at my shoulder when I just told you my knee hurts? Okay. Just understand, I realize that they're the doctors and I know they have an education that goes beyond mine or yours or anybody else's. However, okay, let's remember fraud, waste, and abuse. Okay. We have to ask questions. Does this have anything to do with this? I don't want to have to pay anything else out of my pocket. Okay. Just make sure that whatever you're there for, They are telling you specifically what they're doing for that problem and not trying to tie it to something else. You understand? Okay. Sometimes they will say, listen, let's be safe and do this. No, let's not be safe and do that. All right. Listen, doctors are afraid of liability, right? Doctors are afraid of liability. They don't want to be sued. Okay. Just let them know that, hey, listen, I came here for this problem and I don't want to investigate a million others at this time. We can address that later. Okay. All right. So that's some of it. That's some of it. I don't want to take up a lot of your time, but I do want to at least equip you to be very careful when you communicate with doctors and hospitals and don't overcommit to anything. And then one other resource, look up here at the screen, Pasco County Business Directory. Pasco County Business Directory. Click on that for me. Okay. And when you do there, right, of course, you're going to see all the prime partners that I'm dealing with right now. These are people that I have vetted and I have spoken to, right? And very good people, very caring people, very customer service orientated people. Okay. And so that's, but I'm not really here to talk about that. I just wanted you to scroll past that, past the general referral partners. These are people that I've just bumped into and these are people in the field. You can read that. I don't have time. Here's where I want to talk about Library of Business Documents. Library of Business Documents. I want you to go in here because, right, depending on the service that you are acquiring, okay, I put in here a checklist, a questionnaire checklist, right, for each one. So your specialty doctor, your primary doctor, and your hospital right here. Okay. All right. Those are the three documents that I wanted to talk to you today about. Okay. Because I really feel in my heart that you should have something, right? And you can take these, right? And you would literally just click on the arrow and it'll pop up and then you can print it out. And then you can highlight the certain sections that you really want to zone in on and ask questions about. Okay. Again, I'm just trying to equip you with what you need to protect your wallet, okay, from being drained by entities that are pretty much in the business for making money. Okay. That's their primary goal is making money. So you got to protect yourself. So use these forms. Okay. And there's great questions in there to ask the doctor, to ask the specialist, and to ask the hospital. Okay. Another thing about hospitals, real quick, is they have measurements that they have to meet. Okay. And when they meet those measurements, they're incentivized even more. Okay. So again, look at the document, you'll see and you'll understand that these people a lot of times are driven by money in order to take care of you. So just be careful is really what I'm saying. Okay. Um, Great. I'm hoping that there is a larger percentage of doctors out there that really care about their patients versus money. It's okay making money, right? We all love making money. However, it should be secondary, right? The primary is treating others how you would want to be treated. And you're going to be able to tell when talking to these people which one is the priority, money or your personal care, right? And you'll get that. All right. All right. Again, my name's Keith Salvione. I enjoyed our little talk today. I don't want to keep much time, but hey, listen, call me if you have any questions, anything at all, email me, whatever you want to do. Let's talk and we'll make sure you're taken care of. All right. Thank you again, and you take care.